Havana syndrome refers to a series of unexplained medical symptoms reported by American and Canadian diplomats and intelligence officers in Cuba beginning in late 2016. The condition is characterized by a range of symptoms, including headaches, dizziness, hearing loss, cognitive difficulties, and other neurological issues. Despite multiple investigations, the exact cause remains unclear, sparking widespread debate and concern about national security, emerging technologies, and psychological health. Origin of the term: the name Ante-39, Havana syndrome Ante-39, originates from the location of the first known incidents in Havana, Cuba, where U.S. embassy staff began reporting unusual auditory sensations and health symptoms. The syndrome has since been reported by individuals in other countries, including China, Russia, Uzbekistan, Austria, and the United States itself. Initial reports and symptoms. The first known cases emerged in late 2016. Affected individuals described hearing high-pitched noises, feeling intense pressure, or experiencing an Ante-39 twice head explosion, Ante-39 sensation. Symptoms commonly included hearing loss or tinnitus, severe headaches, balance issues, cognitive difficulties, brain fog, memory loss, nausea, sleep disturbances. These symptoms often appeared suddenly and in many cases were severe enough to warrant medical evacuation and long-term treatment. Epidemiology: over 200 U.S. personnel have reportedly experienced symptoms consistent with Havana syndrome. The cases span multiple countries and agencies, affecting diplomats, intelligence officers, and military personnel. Some Canadian diplomats stationed in Cuba also reported similar symptoms. Hypotheses and theories. Numerous hypotheses have been proposed to explain the syndrome, including 1. Microwave weapon theory. One of the most discussed theories suggests directed microwave or radio frequency energy as a possible cause. This hypothesis gained traction after a 2020 National Academies of Sciences report deemed it a plausible explanation. 2. Psychological or psychogenic illness. Some experts argue that mass psychogenic illness, psychologically induced symptoms, could be a factor, especially considering the stress associated with diplomatic work. 3. Chemical or environmental exposure. Some theories suggest exposure to toxins or unknown environmental agents may have contributed to the symptoms. 4. Ultrasound or sonic attacks. Although less supported, this theory suggests sonic weapons or sound waves could cause inner ear damage or neurological effects. 5. Pulsed energy devices. Intelligence assessments have speculated on the use of pulsed electromagnetic energy as a surveillance or disruption tool that inadvertently caused health effects. Medical evaluations and findings. Patients underwent extensive medical evaluations at leading institutions like the University of Pennsylvania and the National Institutes of Health (NIH). Findings have included brain imaging revealing structural changes in white matter, vestibular, balance-related dysfunction, cognitive impairment resembling concussion or mild traumatic brain injury. However, no consistent biomarkers or definitive diagnostic criteria have been established. Government response. The U.S. government responded to Havana syndrome with a mix of diplomatic actions, medical support, and legislative measures. Downsizing of embassy staff in Havana in 2017, launching investigations by the FBI, CIA, and State Department. Enactment of the Havana Act, helping American victims afflicted by neurological attacks. To provide financial and medical aid to affected personnel. Creation of dedicated task forces to study and address the issue. Criticism and controversies. Havana syndrome has been surrounded by skepticism and controversy. Critics argue inconsistent symptoms and lack of a clear biological mechanism weaken the microwave weapon theory. Delays and opacity in government response reduced public trust. Some suggest the phenomenon may be exaggerated or politicized. Nonetheless, many health experts and intelligence officials continue to treat the condition seriously due to the severity and consistency of symptoms in affected individuals. International perspectives. Other countries, including Canada and some European nations, have taken interest in the syndrome. Canada reduced its diplomatic presence in Havana due to health concerns. Some international scientists have joined U.S. efforts in investigating possible causes and treatments, reflecting a growing consensus that Havana syndrome may represent a new frontier in neurological and defense-related health issues. Treatment and management. There is no standardized treatment for Havana syndrome. Management strategies include symptom-based therapy, e.g., vestibular rehabilitation, cognitive therapy, medications for headaches and sleep disturbances, psychological counseling for trauma and stress. Many patients have shown improvement with supportive care, although some continue to experience persistent symptoms for years. Future directions and research. Ongoing research seeks to identify biomarkers and diagnostic tools, determine the precise etiology of the syndrome, improve treatment protocols, enhance protection for diplomats and government personnel abroad. Emerging technologies in neuroscience, acoustics, and defense may play critical roles in understanding and preventing similar incidents in the future. Conclusion: Havana syndrome represents a complex and unresolved medical mystery at the intersection of neuroscience, diplomacy, and national security. While many questions remain, it has prompted renewed attention to the health and safety of personnel serving abroad. Continued research, transparency, and support for affected individuals are essential in addressing this evolving phenomenon.